Hi, everybody. Thank you for joining our webinar today about open enrollment, upcoming changes coming to the marketplace. Hopefully this will be helpful to you if you're an individual, partner organization, or anyone trying to learn more about the context of what's going on. And we will have a Q&A at the end of it. And so if you'll just hold your questions or put them in the chat or the Q&A, we can get to them. First, a little introduction. Hi, I'm Camille Rishu. I'm the Health Policy Director at Arkansas Advocates for Children and Families. We are a nonprofit, nonpartisan organization that works to better the lives of kids and families in the state, especially those most vulnerable. And in my work, I do a lot of work around healthcare, around health coverage, Medicaid, and insurance policy. So let's talk about our agenda a little bit. So first, we're going to get our bearings. We're going to talk about what the marketplace is, what the heck's a premium tax credit, since that's a big topic of conversation right now. Why does this matter to Arkansas? Why is this very relevant to our health system here, to individuals, to families, to providers in the state? And we're going to talk about the current context. So what's going on with HR 1, aka the One Big Beautiful Bill, and talk a little bit about government shutdown and how that's very relevant to what we're talking about today. We're going to talk about what changes to the marketplace are happening as a result of HR 1, some things around eligibility and enrollment provisions, things around immigrant coverage, some red tape, things like that. Then we're going to talk a little bit about what to do now as an individual who maybe purchases on the marketplace. If you're an organization that serves people, directly on the ground, maybe just a little bit of information to move forward as we are entering open enrollment in the next just over a week. And then we'll do a Q&A and provide some resources. And if you are wondering, we are going to send this out. I know it gets asked a lot. We'll send out those slides and any other resources, links that you might need as part of this. So let's get started. First, let's talk about what the insurance marketplace is. When we talk about the marketplace, if you hear marketplace, that is the insurance marketplace as established in the Affordable Care Act in 2010. It allowed states to establish these marketplaces where people could actually purchase directly insurance. So when we talk about healthcare.gov, we're talking about where one goes to purchase insurance. So if you go to healthcare.gov, open enrollment, the information is there. It allows you to log in, to apply for coverage, to look at the types of plans available. And when we're talking about marketplace coverage, we're talking about you purchasing insurance. So this is for people who don't have insurance through their place of employment, who are self-employed, small business owners, or people who work at small businesses who don't have employer-based insurance, or people in a lot of different situations. For Arkansas, maybe you're working 2 or 3 jobs that none of those provide health insurance. And so you're purchasing insurance for your family. So you're not eligible for Medicaid through income or maybe residency requirements, but you don't have Medicare, you're too young for it, or employer-based insurance. So those are the folks we're talking about here. A little bit of context for who's on the marketplace. So in the US, about 24 million people are currently getting coverage through our marketplace, and that includes about 160,000 Arkansans. Almost all of these people are getting financial help to pay for their coverage in the form of a premium tax credit, which you're going to hear a lot of times throughout this. And that makes your bills lower monthly. And we're going to get into that a little bit more. They absorb the cost of it. What's really important for this conversation is that since 2021, during the pandemic, the amount of those premium tax credits, the amount of money that people can get to help them with their healthcare costs increased during that time and have remained higher. And this has, as you can see by the graphic, has just exploded the amount of people who are able to get healthcare for through the marketplace. Now, a lot of maybe misunderstandings of what's going to happen is that the premium tax credits are not expiring entirely. What's happening is at the end of this year, those enhancements, those increased subsidies, increased supports for families and individuals purchasing, it's going back down to what it was before 2021, before way more people were able to get coverage. So that's what we're talking about. We're saying they're expiring at the end of this year. So, quick rundown on what a premium tax credit is. I'm going to try to make this as not dry as possible. I'm going to try to, take it down to the ways that we understand for our household budgets what a premium tax credit looks like. So they work by making your monthly bill for healthcare more affordable. That's the short of it. So they actually absorb some of those costs of your monthly healthcare premium bill if you purchase on the insurance marketplace. So do a little bit of very simple math with me. I promise I won't do much. But let's say the cost of a benchmark plan, like a middle of the ground level plan that they use to calculate this, is $100. $100 plan. The middle part of that is your expected premium contribution. So that's how much that your household income says that you can contribute to a plan. Let's say that's $25. They'll take that $100 minus that $25, and the amount of your premium tax credit is $75. That's how much they give you to help you pay for your monthly coverage. Hopefully that makes sense. Most people are taking that in the form of the advance premium tax credit. That means that instead of getting it as like one lump sum later, you get it applied every month. So that most people are taking it in that form because you'd much rather, instead of later on getting a tax credit for X amount of money, you'd rather just be paying your, $25 monthly bill that has it applied to it each month. That makes it easier for most families trying to budget. This is not money that is in your pocket. This is money that goes directly to the bill and is credited to it. So hopefully that makes sense. The biggest thing is that it makes your monthly healthcare bill more affordable for families who are purchasing their insurance through the marketplace. Make sense? Now, what are those enhancements? I know we've talked about them a little bit. You'll hear them called the premium tax credit enhancements. You might also hear that enhancements at the front called the enhanced premium tax credit. They're not really different things. It's just the enhancements are those that came after 2021. They were passed in the American Rescue Act plan and they expire at the end of 2025. And they lower, and I'm so sorry for using acronyms without mentioning them, but the expected premium contribution, as we said on that previous math slide. It lowers the cost for people at all income levels. What it also does is it kind of allows really, really affordable, by way of $0, coverage for people between incomes of 100 and 150% of the federal poverty level to pay $0 in their monthly premiums for a benchmark plan. This is very helpful to people in the Medicaid coverage gap. So if you do not know this, Arkansas is a Medicaid expansion state, but you can get Medicaid coverage up to 138% of the federal poverty level. So let's say you're making just over that amount, 140%, which I don't know off the top of my head, but there's calculators online. You don't have access to an employer-based insurance, or you don't have another coverage option, but you make just too much for Medicaid in Arkansas. These enhancements actually make it to where you can get a $0 plan for this group of people who are just off that what's called the benefits cliff sometimes, and there are a lot of folks who are getting coverage in that gap. Now, with the enhancements expiring, net marketplace premiums, that monthly bill, is expected to increase by more than 75% if the enhancements do expire. We'll talk about what that means in real dollars. So we now know lots of people getting insurance through the marketplace. Mostly everybody is getting these tax credits to help them pay for coverage. Now we've reached July, HR 1, aka the one big beautiful bill. This was the largest cut to healthcare and food security in US history. Because of this bill, about 15 million people are estimated to lose their health insurance and become uninsured. That includes people insured through Medicaid and people insured through the marketplace. We'll get into that breakdown. It creates a bunch of new red tape and barriers for Medicaid eligibility and enrollment, including work reporting requirements, which Arkansas has tried before. It also strips access to Medicaid, CHIP, and Affordable Care Act marketplace, those tax credits, from lawfully present immigrants. There's some asterisks there for Arkansas in terms of Medicaid and CHIP, as we do have some protections for child immigrant groups. It also, again, we're not talking a lot about Medicaid, but just to mention, this is restricting our state's ability to actually finance Medicaid. Medicaid is jointly funded by the state and by the federal government, and it kind of shackles us to how we can put up our part of the bill for Medicaid. So it's going to raise the cost of coverage for those 22 to 24 million people in the marketplace by ending those premium tax credit enhancements. It also has a lot of provisions that are just going to make it harder to access and to retain marketplace coverage. So we'll talk about some of those. So the context is that 15 million people who are expected to lose coverage, some of those, the majority of them are going to come directly from Medicaid. About 7.5 million people are expected to lose coverage. Then there are people who are going to, due to some rules in the marketplace, expected to lose coverage, about 3 million. And then another 4.2 million are expected to lose coverage because of the end of those enhancements to the premium tax credits. In Arkansas numbers, we're expecting about 131,000 Arkansans to lose Medicaid and marketplace insurance. About 80,000 of those could come from Medicaid. About 50,000 of those are expected to come from the marketplace. Much of that is because of the work reporting requirements, other eligibility red tape, increases in how often redeterminations happen, the failure to extend those enhanced premium tax credits, and changes around lawfully present immigrants. So some of these, so you're wondering, how is this going to happen? If people can't afford their bill, they're going to fall off of coverage. If you live in a rural area where you're trying to find work, maybe you have health issues that make it hard for you to work in a traditional job. Maybe you're a caregiver. Lots of situations that are going to affect those Medicaid cuts as well. So for just honing in a little more about what's happening with Arkansas and the insurance marketplace. So as we mentioned, like the rest of the country, we've seen huge enrollments in increases in the marketplace since 2021. In Arkansas, about 160,000 people are purchasing directly insurance on the marketplace. There have been some estimations that about half of those on the marketplace are expected to fall off of coverage and become uninsured. Half of people in the marketplace losing coverage is a huge amount. What that means for a community, what it means for our state, when you have more and more people who don't have any insurance coverage, what it means for keeping providers compensated, what it means for hospitals having to take on more uncompensated care. So just all the things that we're thinking about here at Advocates, and what hopefully as a community member or organization you're thinking about. Some kind of specific areas of coverage and healthcare that I think about in our work. Really, first and foremost, we think about maternal health. So as I have, if you've ever been on a webinar with me, I have always mentioned that Arkansas is the only state that has taken no action to extend postpartum Medicaid coverage. We worked very hard on getting that passed, though, and we will continue to do so. But one of the arguments that was made during the session that we did not need to extend postpartum Medicaid coverage was that when we had our Medicaid program for people who were already eligible, and then for those that weren't, we had marketplace coverage. We had those $0 plans for those people making up to 150%. And then we had those very, very subsidized plans on the marketplace that were going to be able to cover new moms who are not eligible. Now, that argument doesn't quite work because very few postpartum moms were actually making it over to the marketplace from all available data that we saw before this argument was made. But we also are like making new moms have to go and purchase insurance when they've got a new baby. It's just the wrong time for that. But if we're taking this argument at its face, we're now going to have these new moms who don't have affordable, low cost plans because these enhancements are expiring. And just in general, plan affordability is already going to be going up. So thank you to ACI for this lovely image. And I've also included a resource that they released about all the insurance rate approvals and the changes to insurance rates. Arkansas's insurance premiums are going to be going up by 22.2%. If you look, that is a huge increase. The average across the US was 18%. So ours is higher than the national average. And I've heard recently one of the highest in the country, if not the highest increases. And this was lower than the original requested rates. So there's a lot of reasons for that. There's, insurance companies have said, oh, tariffs and increased morbidity and increased cost around healthcare and prescriptions, and that's why it's needing to go up. But a lot of this is partially because a lot of people are about to lose coverage. That's expected to happen. So the people who are going to fall off of coverage are going to be people who can go without it. They're going to be people who are hedging their bets. Like, I'm younger, I don't really need much healthcare. I could probably go without. Whereas people who I know I have healthcare costs, I have to have insurance. I have to get this monthly prescription covered. They're going to be the ones who are going to stay, and it's going to make insurance more expensive for everybody. So that is kind of where we're at right now. Another resource that if you purchase on the marketplace and you don't know, if you're wondering like, how much is my plan going to go up? This is actually a result from the Kaiser interactive calculator that I'll link to. And again, we'll send this out. So Kaiser has created a really helpful tool that actually shows how much more would people pay in premiums if these tax credits expire. And for this, we're just going to run through one, and I'm going to make sure that it's big enough where people can see it. So hopefully you can. So for example, we live in Arkansas, and let's say we live in Pulaski County. Let's say a family of 3 makes $65,000 a year. And we don't have coverage available from them or their spouse. There are 3 people. Let's say there's 2 adults. Let's say neither of them smoke. And then let's say there's 1 child in the house. And let's say the child doesn't use tobacco, which we want to see. Now, results here, I'll explain what this means, is on the left side, this is how things are currently. So with the premium tax credits, the first thing says this family of 3 is getting roughly about $700 and $786 in their premium tax credits, covering nearly 80% of the cost of a silver plan, that mid-level benchmark plan. Their cost is about $200 if they're getting a silver plan, and maybe $50 if they're getting a bronze plan, so 1 step lower, lowest level plan. Now, when these expire, this same family of 3 is going to be expected to pay about more than twice as much in premiums for that same silver plan, and significantly more, nearly $300 for a bronze plan. Now, you tell me a family in Arkansas who can happily absorb hundreds more dollars in healthcare costs every month. So, and we actually took another person's information who was kind enough to do the calculator and then send me their results of someone living in Arkansas whose plan is expected to go up nearly $150 from their current plan for a family household of one. So again, we're talking about hundreds of dollars, and in some of the analysis, we've seen families of four who are going to have increased costs by $6,000 to $12,000 per year, which we cannot afford. So here's a bit of information. When will marketplace enrollees be notified? Notices are supposed to come this fall, should be receiving them. We are supposed to be entering the period this week where window shopping with premiums are supposed to be online. That is maybe up in arms because we are in a government shutdown. So there's a lot of questions on what's being done right now because we are entering open enrollment on November 1st. Insurance companies are supposed to provide a notice by November 1st. It may not include the premium tax credit information as usual. One moment, friends. So, another thing to note if you're a marketplace enrollee or if you serve people who do or just wanting to know is that about half of people are already automatically enrolling. If you're anything like me, I don't re-enroll in my car insurance each year. I let that thing roll over unless I need to make changes to it. About half of people are doing the same thing on the marketplace. So people who are automatically enrolling may not realize that their premiums are about to go up by hundreds of dollars until January when their bill arrives. So we need to be letting people know that this is coming. And they need to make changes before, January 15th. So they'll have a very short period of time in which to change that before they either fall off coverage or are stuck with a huge bill. We're going to talk, there's a couple of text heavy slides here, but it's important to note what other provisions are affecting enrollment on the marketplace. So one of the ways that HR 1 was extremely cruel to immigrants was that it impacted a lot of legally present documented immigrant groups. So this is already in effect, but people with DACA, Deferred Action for Childhood Arrivals, are ineligible for marketplace coverage or premium tax credits effective in August. And their coverage ended September 30th in most states. Lawfully present immigrants with incomes below 100% of the federal poverty level who are ineligible for Medicaid due to required waiting periods in Medicaid, usually a 5-year waiting period, are no longer eligible for premium tax credits. And then there's some provisions coming later, so 2027, 2028, and then beyond. Most legally present immigrants in the country are no longer eligible for the premium tax credits. The only groups that will still be eligible are legal permanent residents, green card holders, Cuban and Haitian entrants, and COFA immigrants are still available. So in Arkansas, that would mostly be our Marshallese neighbors. Again, there is the caveat that Arkansas takes this option that covers immigrant kids and pregnant women. So those groups that were cut out, and some of those groups include people, asylum seekers, victims of human trafficking, U visa, TPS. There's a lot of different immigrant groups who are legally present, are losing access to marketplace and Medicaid coverage. Arkansas does good work by maintaining coverage for kids and pregnant women, but if you are an adult who is a victim of human trafficking, this bill affects you or the community members that you serve in your organization. So it is important we note that and are sounding the alarm about those groups. There's also the elimination of what's called the low income special enrollment period. So normally, as we're talking about open enrollment, normally you can only enroll in marketplace plans during this period. But if you have an income under 100% of the federal poverty level, you can enroll all year round as part of this special enrollment period that's income based. The new regulations ban marketplace from offering this, and it also makes people who are trying to enroll through this ineligible for premium tax credit. So it's coming at you from both HR 1 provisions and some rule changes mentioning that. And again, not trying to get too in the weeds, but let's talk about the elimination of the advanced premium tax credit repayment caps, because this is all about how much people have to pay, the debt that they get into, and what piles up for low to moderate income households. So today, people with low to moderate income, so those under 400% of the federal poverty level, they're protected from owing large amounts of that premium tax credit if their household income changes during the year. Because when you enroll, you have to like estimate what you think next year's income going to be. And sure, if you have one single full-time salary job, that's probably pretty easy. But many people working shift jobs, gig economies, multiple jobs, lots of situations, there can be some differences in that. So in 2026, people whose actual incomes is maybe higher than what they thought, because maybe they were being more conservative with what they thought they were going to make, they will owe back all of the advanced premium tax credit they received. So that means that people could owe hundreds or thousands of dollars more than they would today, and they won't feel that until they file taxes in 2027. And just to give you an idea of some of the examples of situations that could lead to people owing thousands of dollars. So maybe you get a new job or a raise, and you are trying to better your life. And then suddenly you're in a huge amount of debt when tax season rolls around. Maybe you qualify for Social Security disability. Maybe you're married and you separate mid-year and then you file taxes later as married filing separately. Currently, there are these caps that just basically say if you estimate this wrong, this is the maximum penalty. It basically it says you can pay whatever penalty is excess. So it's going to make it a lot harder for people who are trying their best to estimate. It also doesn't give you any more for overestimating, just for underestimating. Then some other red tape and provisions. So that data matching issue, so verification of data, all those other kind of bits for getting the advanced premium tax credits. You're going to have less time to do it before you're penalized or not given coverage. It also it is increasing your income verification requirements, so lots more red tape, lots more verification required in 2026. If you are enrolling through that special enrollment period for those situations where you maybe you get divorced, you have a child, different situations, you lose a job, you get a different job, you have to go through more and more verifications. It's also increasing $5 monthly fees for some people who are automatically enrolled, which doesn't seem like a lot. But again, for some of those lowest income folks who are purchasing, it does matter. $5 a month adds up. It also says that people who've not filed and reconciled their past advanced premium tax credits are ineligible for any further premium tax credits. So effectively ending coverage for people who might be struggling. It also may require people to pay premium debt for allowing them to continue enrolling, even if they're trying to catch up. I bolded all of these because these are currently halted until litigation is resolved, because there is a federal injunction. So these are not in effect at this time because they're working through the courts. But these are provisions that are there, and they could be allowed to continue depending on the results of the court. Just mentioning this, open enrollment dates are also shortening. This won't affect Arkansas because ours is remaining the same, but just for an idea of what some different states kind of offer, Arkansas is November 1st to January 15th. So what now? I've given you a lot of information. What do we do with it all? First, we need to let people know that a lot is changing. There are a lot of people who still do not realize that their premiums are about to go up, that a lot is changing with healthcare. So first, if you're working with a partner organization or people serving those with marketplace coverage, they need to be actively updating their information, going online this week, comparing plans for 2026 on healthcare.gov. Look out for those notices that they're supposed to be sending, respond to those requests for verification, find ways to help them reconcile their advanced premium tax credits during tax season. We need to be prepared to help people who do not roll in marketplace coverage, connect with community health partners, because it is a fact the number of uninsured people is going to increase next year. That is just a reality, and we need to get ready for it. We need to notify folks about that automatic enrollment. Just because they stop that open automatic enrollment does not mean that they can't enroll maybe in January, up to January 15th. They included this sort of action steps to include for affected households. So if you're worried about not being able to afford your premiums, updating your information, stay up to date with premium payments. If you're worried about losing coverage, reading notices, just some different suggestions that some partner organizations have put together about your taxes and whether you're eligible. We'll include those. Now, how do we mitigate the harm? Unfortunately, at this time, there's not a lot of policy levers here. The biggest one right now is that the government is shut down. And much of the reason that the government shutdown is happening is because of the end of these premium tax credit enhancements. If you have not done so, and now you understand premium tax credits and why they're important to getting people coverage and maintaining coverage, you should be talking to your elected officials about your concerns. We are asking folks to say, we need to end the shutdown and we need to extend these premium tax credits because, the health care of hundreds of thousands of Arkansans rely on them. We need to be helping people find enrollment assistance. So any of the questions that are really in depth about insurance in Arkansas, I will not claim to be an expert on, but I included the insurance department information in these slides, and they have all of their contact information here. If you have questions for consumers, for any kind of admin questions that I don't know the answers to. There are also some navigator organizations. So our state doesn't fund navigators, but there are some funding streams federally for federally qualified health centers and community health centers that do have federally funded navigators. I would also encourage, whenever you go to healthcare.gov, to go to their Find Local Help link. And if you put in your zip code, let's see, 72205, and it will pull up a list of navigators, assisters, brokers that you could get support from locally. If you're a provider, if you work with a community clinic, you probably already know and are probably already experiencing that people are going to have increased needs for healthcare, for more people seeking help for who are uninsured. We need to be thinking about the ways that we're going to mitigate people losing healthcare. And we need to spread the word. So now that you have some of this information, we need to be sharing with other healthcare providers, community organizations, other members of your coalition, your school districts, because there are lots of thousands of kids are insured. This is not just an adult population. We're talking about entire families who are purchasing on the marketplace. Kids whose maybe their household income is too much for Our Kids First, but they don't have other coverage options. There are kids covered. We need to ensure that we're really spreading the word. You should be connecting with us. If this is your first webinar with advocates because you are really concerned about this, please connect with us after this. If you are purchasing insurance on the marketplace and you go on there and you're seeing how much your premiums are going to increase, reach out to us. We want to know what actual everyday Arkansans are going to have to absorb with the increase in premium costs and decreasing of support in those premium tax credits. People are going to be paying more to keep health care. which is so hard at a time where people are struggling, where people are losing SNAP benefits, where families are having to make hard decisions every single month. So please get connected with us and get involved. And with that being said, I will pull for questions. And thank you so much for your time. I hope that this gave you some valuable information. I hope I didn't roll to it through too quickly, but I wanted to make sure we had time because I see the chat filling up. But again, thank you.
Thank you so much, Camille. That was a lot of really helpful information. We have some questions coming in, as you noted. Our first question is, if people who are automatically enrolled get a higher bill in January that they weren't expecting, is there anything they can do?
Yes, they are able to change that plan, but they have a shorter amount of time to be able to do it. Like you have to do it, I assume, from my understanding, before open enrollment ends. So you have to make decisions on going and looking at plans. What can I afford? What can I change? What are my options during open enrollment? So you just because you are given that plan that price in January it does not mean you have to pay it. You're going to have to make decisions on, okay, you're going to see more people maybe moving. Okay, I had a silver plan. Maybe I go to a bronze plan. Maybe I can afford that one. Um, but you can do it. You just have a shorter period of time to reconcile it.
Thanks. Our next question is, do you have any data on single parents and or older adults that will be affected by these changes?
Um, I have some information we can include in our links. I mentioned it earlier, but I believe it was CBPP, the Center for Budget and Policy Priorities. They did an analysis of families of different makeups and ages and income levels, what their expected premium increase is. So it's like, oh, family of two 60-year-olds are expected to pay this much. And a family, of two making this much money. So we'll include that in the resources and would be happy to send that out. Again, a lot of this information is like what's going to happen. So some of this we'll see it as we see what happens with enrollment. I would encourage you to go and look at and compare plans and look to see if how much you're paying now and how much is expected to based with that calculator from Kaiser.
And Camille, I actually remember one of the numbers for that. I won't say older adults. I will say out of the age range possible, on the older side, 60-year-old couple who make
Somehow
80.
that's worse.
I don't know. I genuinely don't think 60 is old. But anyway,
Oh,
like of the age range they had, that was the oldest age. They a couple that's 60 years old making $80,000 a year, they would see their premiums increase $16,000 a year. And I remember that one because that was really
yeah.
shocking to me.
Yeah. I mean, who has a spare 12, $16,000 lying around to keep healthcare? Um,
Not a couple making $80,000.
no, certainly not.
Our next question, I can actually answer this. Camille, that's a great call of action. Do you have a template, or does AECF have a template for us to contact our policymakers? We do have an action alert going right now, and I'll put this in the chat right now, and I'll also send it in our follow-up email with the slides and the recording and everything. This is to ask Congress to end the shutdown and make sure that we do get those premium tax credits. As the shutdown continues, all of y'all know that we're at more and more risk of programs having serious issues. So that's the link to that.
No, that was the perfect question to ask for Rebecca, who is our community engagement director extraordinaire.
Another question that we had was, how can people who cannot pay the higher amount opt not to continue in the program?
they can disenroll in coverage before the end of open enrollment. That's really the option is basically they during the open enrollment period, they pull themselves out of continuing coverage. If they don't have automatic, re-enrollment, then they wouldn't anyway. They'd have to choose a plan and enroll in it. But for those with automatic re-enrollment, they would go on the like healthcare.gov in their account information and opt out of continuing coverage.
Thank you. And the insurance department's on and sharing several good resources, and we'll
Oh,
make sure
yes.
that we send that in the follow-up email. So thank you so much for
Yeah,
sharing
thank you
those.
so much to the Arkansas Insurance. I know you guys are the experts on some real nitty-gritty stuff, so appreciate you being here.
Another question, how can we get a copy of the income and household scenario? Where's the calculator?
I will, it is on the Kaiser one. We will include it. I will actually, let me just
And I believe
I
the
have it.
insurance department put something similar in the chat that I'll share also in the
Throw it
follow-up
out
email.
while I'm here. Did I pass it? No, I did. I went right by it. I never do this, but I just wanted to pull it up so I can throw it in the chat. And like I said, we'll follow up with all these links. That is the calculator for that.
Thank
Yeah,
you.
happy to help.
And this is a specific question. I'm not sure if you can answer, or maybe someone from the insurance department could put in the chat. The person says, I have income through October 31st, uh, but my IRF starts on November 1st. How do I fill out the
Shakia, what's acronyms? What's RIF?
Yes,
Is that when you're
reduction in
leaving?
force, I think.
Ah, right. Yeah. I should know
Um,
that.
how do I fill out the income information section?
That's a question for kind of the specifics and maybe one that the insurance department may be contacting their consumer support hotline, which is in that link. Shakia, I'll send that over to you to make sure you have it. I would never claim to be someone who helps with any enrollment. I'm not an assister or broker, but we can include the information for people who can help you with it. Oh, no, please don't apologize. We're happy to help connect you with the right people.
And if you have any other questions, please put them in the chat. I'm going to have a bridge question to see if anyone does have final questions before we end up today. But Camille, we've talked a lot about in Arkansas Advocate's office about how this will impact our state's hospitals, all these changes happening federally to the marketplace and also Medicaid. Can you talk about what might happen because of these for our healthcare system?
Uh, yeah, there's a lot of unknowns right now. I mean, there HR1 cut billions of dollars that would normally be coming into Arkansas over the next 10 years for healthcare. Um, that is going to be bad seems like an understatement, but we've been insulated in a lot of ways. Arkansas was an early Medicaid expansion state. We have not experienced the hospital closures that states surrounding us who did not expand Medicaid have experienced. And right now, 70% of rural hospitals in Arkansas are operating at a loss. And the reality is that when you have a lot more people who suddenly do not have insurance, they rely on emergency rooms for their health care. You're not getting preventative care. You're waiting until something becomes an emergency because you don't have, $300 to go to a primary care provider and pay out of pocket. So I think we're going to see more uncompensated care, providers, free clinics having to take on more patients. You're going to see people who are going without prescriptions they'd otherwise need or care they'd otherwise need. There's also this kind of big question, getting into, the high risk pools and a bunch of in the weeds stuff. But having lots of people insured who are generally healthy means that everybody's healthcare costs less money. Your health insurance costs less money. More people holding up your insurance group. When a bunch of people who are healthy leave that group, the people who are holding it up are people with more health issues who have more health needs. So basically your insurance group is being held up by fewer people who are carrying more weight. Um, so you're gonna have everyone's gonna be impacted by that. I'm really concerned about, the stability of the marketplace. If 50,000 people fall off of it, what does that mean for the other folks who are on there? What does that mean for their premiums? And I think that's part of the reason why those premiums are going up so much, is that they're expecting a lot of people to lose coverage. As for hospitals, and other providers, especially rural providers, if they can't keep their doors open because they're not getting reimbursed for their services, it can mean the loss of your small town hospital. And that's just, that's so destabilizing for an entire community, for the workforce, from your doctors to your techs to your food service workers, everyone who is in the ecosystem of a rural hospital. And it means you have to travel longer for care, especially in emergency situations. Arkansas is contending with a maternal health crisis with lots of rural healthcare disparities, and making it harder to get care quickly is not going to be good for keeping folks healthy in Arkansas. Um, so I'm very concerned about it. I think we should all be concerned about it, and I think we need to talk to our leaders about it. That's
Well,
my
we
soapbox.
We don't have any more questions, but we have lots of thank yous and good jobs. So
Always happy to help. Please reach out. My email is on the screen. If you have further questions or if you want to get involved, I would be happy to talk to you.
thank you so much, Camille, and thank you all for joining us. Like I said, I'll send the slides and recording after the event. Take care, everyone.
Have a good day, y'all.